Hello everyone. Today we are going to discuss about the Leuprolide injection that comes in 3.75 mg of concentration. The Leuprolide injection, or you can also see its name as Leuprolide depot injection. The images of this injection, the constituents, what all is there in this injection, this I'll be sharing after this video in the form of the photographs of this injection. So this Leuprolide injection is mainly constituted by a vial in which the powdered form injection comes and another ampule in which the distilled water comes, plus one syringe and two needles, one for its dilution and one for the administration. So this is the basic component of this injection. So now we are going to see that what it is going to do or what it is used for. So this Leuprolide injection is mainly used to treat endometriosis. The Leuprolide injection is used to treat endometriosis plus another condition that is known as uterine fibroids. Now the question arises, if you are not aware of these two terms, that what does they mean? So endometriosis means a tissue, growth of a tissue that is similar to that of the uterus. Growth of tissue that is similar to that of uterus, but it is outside the uterus. So this condition is known as endometriosis. In endometriosis, what happens that if this is your uterus, then a tissue whose characteristics, whose features are similar to that of the uterus, but they grow outside the uterus. For example, this is an extra tissue that is growing outside the uterus. So this condition will be known as endometriosis. Now another condition we will be discussing is uterine fibroids. What are uterine fibroids? This is non-cancerous growth of muscle tissue of uterus. So what happens here, if this is the uterus and this is the muscular layer, so in the muscular layer growth of extra muscle tissue occurs, but this is non-cancerous. This growth of tissue is not cancerous. So this kind of condition is known as uterine fibroid. So this Leuprolide injection is mostly used to treat endometriosis, uterine fibroids and other conditions related to both these disorders. So for the treatment of uterine fibroids, if you are going to treat this treatment, then Leuprolide injection is given in combination with injection iron sucrose, or is given in combination with iron. Why? Because in this condition a lot of uterine bleeding or vaginal bleeding is happening, so which results in decreased hemoglobin, and to maintain that hemoglobin you have to give an extra of iron. So whenever there is a condition of uterine fibroid, you have to give injection iron along with the Leuprolide injection to control the or to manage the hemoglobin level of the women. The Leuprolide injection mainly reduces other symptoms of these conditions, which include pelvic pain, or that may also include painful or heavy menstruation. So if a patient is suffering with condition of painful or heavy menstruation, that is dysmenorrhea or menorrhagia, then also this Leuprolide injection can be prescribed. Along with that, it is also helpful in treating abdominal bloating. So these are the main symptoms that are controlled by this Leuprolide injection. So how does this Leuprolide controls these conditions? So what it does, if we are using it in case of endometriosis or uterine fibroids, then it controls the condition by, it works by shrinking the abnormal tissue. So this is what it does. It shrinks the abnormal tissue, thereby treating the both conditions. And how does it shrinks the abnormal tissue? For the growth of the uterine tissues, you know that a hormone, that is estrogen, is required. Estrogen is required for the growth of any kind of tissue in uterus. So this works by inhibiting the production of estrogen in the body. So whenever you are giving the Leuprolide injection, it works by decreasing the production of estrogen in the body, thereby shrinking the abnormal tissues. So in short, this is the pathophysiology of this injection, that how it works. Now how is it given? This injection is usually given IM and in 3 doses, and each dose will be 1 month apart. Since this is a slow acting drug, so this drug takes approximately 1 month to give its full function, and it slowly releases its medication into the blood over a period of 1 month. And it injects dose into the body within 1 month of its administration. So mainly 1 month apart, 3 doses of the injection are given. Now I had told you that there is a vial containing the powdered form and a distilled water bottle. So we have to combine these two. But when you combine these two, then within how many minutes or hours you can use the injection? So the answer will be within 2 hours of reconstitution, the injection should be used, not before that. Okay. So during the first few weeks, what will happen whenever you will give this injection? During the first few weeks, the production of estrogen will increase, because we were expecting the production to decrease, but its pathophysiology is like that the production of the estrogen will increase in first few weeks and then it will decrease gradually. Okay. And it takes, whenever you are starting this injection, we have to continue it for minimum of 3 months, because it takes around 3 cycles of the dosage to control the symptoms properly. So this was about the Leuprolide injection in short. After this explanation, I will be sharing the photographs of the injection, its constituents, that what is present there in the injection. So let us have a short quick look at the injection, the details again. The Leuprolide injection, that is of 3.75 mg, contains of 1 powdered form ampule, 1 distilled water ampule, a syringe, and plus 2 needles. And whenever you are going to mix these injections, you have to use it within 2 hours. Otherwise, you will be you need to discard the injection. You cannot use it after 2 hours of constitution. Then 2 needles are there, one for mixing and the other one you have to change and then administer it to the patient. And how are you going to administer it? We have to give it IM. In IM, you can use either gluteal region or the deltoid muscles according to the muscle mass of the patient. And this is used to treat endometriosis and uterine fibroids. What is endometriosis? The growth of the tissue similar to that of uterus, but it is outside the uterus. This condition is endometriosis. And uterine fibroids, the non-cancerous growth of the muscle tissue of uterus is known as uterine fibroid. And whenever you are going to give it in case of uterine fibroid, you have to combine it with injection iron and then give. Why? Because the increased amount of vaginal bleeding due to this condition leads to decreased hemoglobin, and to maintain that the hemoglobin level of the body, you need to give it with iron injection. Then this injection also reduces the symptoms of pelvic pain, painful or heavy menstruation, along with that abdominal bloating. And how does it work? It works by shrinking the abnormal tissues. Since estrogen is needed for the growth of the tissue in the uterus, Leuprolide injection decreases the production of estrogen, thereby shrinking the abnormal tissues. And how you have to give it, how frequently you need to give it? You need to give 3 doses. That should be 1 month apart. And in the first few weeks of giving the injection, your production of estrogen will first increase and then it will start decreasing slowly. So your symptoms may even get worse just after giving the injection. But you need not to worry. You must know that in the first few weeks the production of estrogen increases and then it decreases the production. And you need to give 3 complete cycles of this injection to control your symptoms fully. Hope this was useful. And after this we will be seeing the photographs of the injection, the constituents of the injection. Thank you.